A wonderful day to each and everyone. I am Daniel C.Fermin, and I will be presenting to you our research study entitled The Evaluation on the Strategies of the 15th Strike Wing Implemented During the Pandemic. So for our introduction, I will start with the background of the study. We all know that the world was unprepared for the rapid spread of the pandemic, causing widespread disruptions in our daily lives. Measures like isolation and travel restrictions were implemented worldwide. This research focuses on the impact of the pandemic on the 15th Strike Wing operations, exploring changes and challenges faced by the personnel and the organization. This study aims to assess strategies of the 15th Strike Wing implemented in response to the pandemic, focusing on the enhancing organizational efficiency and resilience. It also addresses questions related to respondent demographics, describes implemented strategies concerning doctrines, personnel, material, facilities, and also evaluates differences in strategy evaluation based on the unit. So for the methodology, to carry out this study, the descriptive comparative design was used to assess the strategies and implementations of the 15th Strike Wing during the pandemic. A descriptive study is an observational study of effectiveness in gathering information without changing the environment. The study involved 100 carefully selected personnel from the 15th Strike Wing, assigned between 2019 to 2022, distributed across four groups: Headquarters Administrative Services, Tactical Units, 1st State Aircraft Maintenance Group, and lastly, 590th Air Base Group. To summarize our findings, first is the description of demographic profile of the 15th Strike Wing. Respondents' names were optional to maintain privacy, focusing only on specific details regarding their evaluation of 15 Strike Wing's implemented strategies during the pandemic. Rank, particularly in policy implementation and decision-making, played a crucial role. Information was gathered from selected officers and random enlisted personnel with deployment experience during the pandemic. Policies and standard operating procedures were crafted by the key officers and enlisted personnel of the 15th Strike Wing. Among units, tactical units were most affected, facing challenges in the distribution of medical supplies, personnel manning, and rotation with the highest number of personnel in quarantine facilities. In relation to the provided materials, staff members are incredibly content with the accessibility of vitamins and supplements from the units, which aids in enhancing immune systems and mitigating vulnerability to viruses. However, these supplements were not provided to deployed personnel, which may have increased their susceptibility and negatively impacted the unit's overall performance. Regarding the facility aspects, quarantine facilities located within the base that house personnel from deployment or designated as close contacts are regarded with high levels of satisfaction. Nonetheless, due to the limited availability of the rooms, patients must be transferred to external quarantine facilities in Metro Manila to receive treatment and isolation. So for the difference in evaluation of implemented strategies, most personnel from various units concurred that the overall implementation of the 15 Strike Wing strategies was highly influential during the pandemic. Nonetheless, several individuals, especially those from tactical units with prior deployment experience, voiced skepticism regarding vitamins distribution, facility availability, and staffing needs. Suggestions encompass enhancing operational strategies, working arrangements, and the allocation of quarantine facilities in order to accommodate deployed personnel more effectively. Next is the suggestions to enhance strategies implemented during the pandemic. Strategies should be updated annually to align with the current threats and issues, extending beyond COVID-19 to address various health challenges. The study reinforces and introduces new strategies incorporated into the 15 Strike Wings Battle and Crisis Management Action Plan. Priorities include implementing policies for base rules and regulations, exploring alternatives for working schemes and manpower, enhancing logistics systems, and creating programs for facility improvement. Lastly is the proposed SOP based on the results of the study. The proposed SOP enhances the 15 Strike Wings approach to potential threats, offering a versatile framework applicable not only to military subunits but also to organizations with complex structure. For our conclusions, policies and standard operating procedures minimize widespread effects, contributing to the fulfillment of the unit's tasks. However, limited rooms for infected patients pose a challenge. The study also identified lessons and best practices, including restricting personnel activities, designated task assignments, and stringent adherence to health measures. And for more effective and efficient strategies and implementations of the 15th Strike Wing during pandemic, we recommend a regular updating of doctrines. By constantly aligning the policies and SOPs to current threats and considering opportunities to improve, the 15th Strike Wing can become adaptive and resilient in dealing with different crises. Next is the strict enforcement of protocols. The safe environment of the 15th Strike Wing, despite the 16th pandemic, is maintained because of strict implementation of safety measures and contact tracing. Therefore, it is essential that such practices be continued and improved if necessary. Next is the continuous evaluation. To cope with the fast-changing scenarios of the pandemic and maintain up-to-date information to combat health threats, regular assessments and evaluation of strategies and policies should always be done. We also recommend to improve delivery system. The timely distribution of sufficient food supplements and essential items to all personnel of the 15th Strike Wing in order to boost their immunity and maintain a healthy physique. Next is to improve work scheme. To ensure a completion of mandated tasks and welfare of personnel, despite the challenges of the pandemic, the improvement of work schemes such as skeletal force and deployment should be a must. And lastly, upgrading of hospital facilities. The 15th Strike Wing will continue to increase its personnel. Further, it is essential that having adequate hospital facilities or partnership with another medical facilities, both public and private sector, will ensure that personnel will be provided with needed medical attention and facilities. Once again, I am Daniel C.Fermin. Together with me, Geronvic Aguinaldo and Mark John Adel. And before we end our presentation, we would like to thank Dr. Florinda G. Bigonte for guiding us to finish our research.